I'm Chrissy. I'm going to talk about hoarding, and this is Kiki the dog, Leilani the cat, and my audience, Francis and John. We're going to get started. Thanks for listening. It's easy to get rid of things when there is an obvious reason for doing so. It's much more difficult when there is no compelling reason. Human beings can only cherish a limited number of things at a time. These are direct quotes from Marie Kondo. According to the KonMari method, derived from Marie Kondo, who has become quite notorious from her book, The Magic Art of Tidying Up, people are encouraged to discard items that no longer exude joy. In other words, we should really only be keeping items that have purpose and meaning. We all have a number of possessions that we live with, things that we've collected over the years, inherited from our parents or grandparents, hobbies, projects. There comes a time when some of these items are discardable and we no longer cherish them, so we get rid of them. But for those who suffer from hoarding disorder, these kinds of decisions are much harder to make. Today, I am here to talk about the compulsive behavior of hoarding disorder, which, if not treated early, can lead to lifelong consequences. According to the American Psychiatric Association, hoarding disorder occurs in people who have trouble parting with possessions, regardless of their value. The Wyoming Center on Aging found that hoarding disorder is linked to impulsive behavior, and 20% of those with hoarding disorder also have OCD, or obsessive compulsive disorder. Indecisiveness, perfectionism, difficulty organizing, the inability to plan, anxiety and depression, these are all associated with hoarding disorder, further leading to isolation, loneliness, and the inability to perform daily tasks as severe as cooking and bathing. Hoarding disorder begins early in life, around the age of 15 to 19 years old, and increases in severity each decade. It can be due to a stressful life event like the death of a loved one. It can start with the collection of unvaluable things like empty cereal boxes, mail, newspapers, even animals. And it is estimated that about 2 to 6% of the population suffer from this disorder. But experts speculate that these numbers are higher since this is a hidden truth. Issues with problem solving, sustained attention, and working memory are reasons to seek early treatment in order to recognize the importance of improving this behavior. Consequences of not seeking early treatment result in problems with relationships, both social and with one's work activities. This can further lead to family strain and conflict. This can be due to legal and financial problems like credit card debt or high expenses. People with severe hoarding stop allowing others into their homes because surfaces start to pile up, leaving only narrow paths to maneuver through the house. And suddenly health and safety concerns are at stake, causing fire or trip hazards or even health code violations. The International OCD Foundation has listed treatments for hoarding disorder. These include motivational interviewing, or MI, which is a technique to increase the motivation to make positive changes in one's behavior. Individuals can then connect their values and goals with behaviors. Skills training is where people learn how to organize their belongings within their homes. This includes using problem-solving methods to address common problems with clutter and how to make decisions about keeping needed items and removing unwanted clutter items. Cognitive behavioral therapy, or CBT, helps individuals change problematic behavior through sorting and discarding, and challenging one's thoughts and beliefs about their attachment to items. Support groups are also used for hoarders to meet regularly to give and receive support in a shame-free environment. And finally, psychiatric medications are sometimes used to change individuals' brain chemistry and activity. To conclude, hoarding disorder is a difficult problem to treat due to the resistance in patients wanting to get help. Due to the isolation and loneliness involved, we don't actually know how much of the population hoards. There could be way more. Cluttered living spaces become unusable, causing stress in day-to-day activities, affecting overall decision making. Early treatment is necessary to help turn this behavior around and eliminate health and safety hazards down the road. Two of my friends have parents with hoarding disorder and both lost their homes this year due to fires. One was set by the hoarder herself when she left a heat lamp on in New Jersey, and the other was just swept away last week in Santa Barbara's Aliso fire. A couple of my family members also have hoarding disorder, which has definitely caused a strain on the familial relationships. As we know that hoarding is a mental disorder associated with anxiety and depression, if one can detect this early, one can continue through life clutter-free. Thanks for listening.